Well, I'd like to introduce myself. I'm Dr. Anthony Dailley. I've been a practicing general dentist for 34 years now. Of those 34 years, I have been treating patients with chronic halitosis on a very regular basis. There are a lot of misconceptions that we see about this problem, and patients come to us all the time. Unfortunately, a lot of the misconceptions are also a result of the internet today, because there's a lot of information out there that is not necessarily all correct. Probably the most misconceived idea about what causes halitosis is actually due to gastrointestinal issues. People assume that this is a GI problem, and they also assume that certain foods will cause this problem too. Our experience has been that GI problems do not cause this. Gastrointestinal issues are all over the place out there. Gastric reflux is a common condition that people have, but for various anatomical and physiological reasons, these do not cause a problem. In the 19 years we've been treating this, and some 15,000 or so patients we've treated, we've never seen a gastrointestinal issue cause this. On the same token, foods can certainly produce food odors. No question about that. We all know that. Garlic, onions, all these things. But those are not halitosis. And of course, if you don't like the odor of that food, it's pretty simple. You just don't eat it. People oftentimes can assume that this problem is a contagious issue. So they're afraid of passing it on to another person or a spouse and vice versa. But it clearly is not a contagious issue. The other really common misconception that we see out there about this is that this problem comes from tonsils. And there are these things called tonsilloliths, or what we refer to as tonsil stones. And there's a lot of literature out on the internet that blames these tonsil stones for halitosis. But the reality is, in all the years of treating this, we've still not seen a case of halitosis being caused by that.